Assisted reproduction. What is assisted reproduction? Assisted reproduction or assisted reproductive technology is any and all fertility treatments in which both egg and sperm are handled. With that said, any treatment that only handles the sperm is not considered to be a part of assisted reproductive technology. There are different forms of ART, but in vitro fertilization is the mainstay. In vitro fertilization is a process in which a woman's eggs and a man's sperm are combined outside the body. Once the egg is fertilized and transitions into an embryo, it is implanted into the uterus to develop. In vitro fertilization can be divided into two variations: gamete intrafallopian transfer or zygote intrafallopian transfer. Gamete intrafallopian transfer, or GIFT, is similar to IVF, where the egg and sperm are collected, but instead of fertilizing outside the body, the gametes are transferred into the fallopian tube for fertilization. The process is more advantageous for those concerned with religious convictions, as fertilization is still done inside the body and not in a test tube. Zygote intrafallopian transfer, or ZIFT, is the other variation of IVF, as the fertilization is done in the lab, but the implantation occurs in the fallopian tubes. This particular version of IVF is considered more feasible for women whose uterus may not be a healthy environment for development. The ultimate debate. Now, I looked more into the pros and cons of assisted reproduction, and it was pretty consistent throughout all that the pros and cons focus around three individual situations. Those situations have been laid out across from each other to make it easier to see, but the first situation is based on the idea of family. Those who are pro-ART view the technology as a way to provide a child or to provide a family to all those who want one, including being an option for single individuals, unmarried heterosexual couples, and homosexual couples. For those against ART, view the family as nothing more than nuclear. So these proponents to ART view family to be the very traditional mom, dad, son, daughter, and view that the option for ART ruins that idea of that nuclear family. Another situation is the presence of any genetic disorder. For those who are pro-ART, disorders that are sex-linked can be deciphered and treated with ART and supplemented with an intervention called pre-implantation genetic diagnoses. So PGD is utilized for a lot of childhood conditions that can be tested for and that are genetically based. So if if I as a mother have certain genetic disorder, with the use of ART and PGD, my baby will not have that. I will be testing and treating for those diseases. For those who are a proponent of ART, it's under the pretense that I have this genetic disorder, but it's God's will if my baby will have it. So they view any and all genetic disorders as something that is God's will that I as a mother would have, and through the use of prayer and thought that it would possibly not be passed on to my baby. The third situation is really focused on how the proponents of ART view these children that are conceived via assisted reproduction as test tube babies. It's a way of reproduction without sex. It's a way of having a child in a marriage that wasn't conceived through parental love and the act of loving, and the idea that a married couple, that you don't have sex prior to marriage, and married couple are the only ones, again, that can have these children. According to the U.S. Convention of Catholic Bishops, that necessarily isn't the case. It's more of a misnomer. One of the bishops stated in an article that I read regarding the pros and cons of ART is that, like all children, regardless of the circumstances of their conception and birth, they should be loved, cherished, and cared for. So really the idea that these children are test tube babies, that children of IVF are something of monstrosity to the church, it actually isn't as necessarily true.
All right, so with spiritual and theological implications, assisted reproduction is becoming more prevalent as technology advances and more people are learning about it. So naturally, different religions have begun to form opinions and take stances on this seemingly controversial subject. The three different religions that I'm going to discuss and their opinions on assisted reproduction are Catholicism, Judaism, and Islam. So first, the Roman Catholic Church rejects any sort of reproductive technologies that manipulate human embryos. However, they find procedures that assist with natural conception allowable or permissible. The egg and sperm must meet on their own and within the biological mother's natural reproductive system. And there are two types of assisted reproduction that the Catholic Church is okay with. The first is intrauterine insemination, or IUI. This procedure involves preparing and delivering sperm directly into a woman's cervix or into her uterus. The second approved method is gamete intrafallopian tube transfer, or GIFT, which was discussed before. And this procedure involves the sperm and egg being placed together in the fallopian tube. And although these treatments are allowed, the method for collecting sperm cannot be through masturbation. Furthermore, the Church forbids any third-party reproduction, including egg donation and surrogacy. In Judaism, the method of assisted reproduction of in vitro fertilization is generally accepted, but there is still some debate around the subject. It must entail the supervision of a rabbi to be in accordance with the Jewish law. And there is no consensus among the Jewish people about egg donation and surrogacy. The debate is mainly around the child's status and whether it depends on the woman carrying the child, the egg donor, or both. So essentially they want the child to be Jewish, but they're in debate on who exactly that Jewish line depends on. And in light of this debate, Israel has passed a law that allows women to donate eggs to infertile couples. In this process, the identity of the donor is not disclosed, but recipients are allowed to check the religion of the donor, since there is controversy about whether the child is Jewish according to the donor or legal parent's descent. And with Islam, Muslim jurists have researched assisted reproduction and if there are answers to the controversy in the Quran. They reached a decision and stated that in vitro fertilization is allowed if the semen and ovum are from a legally married couple and if fertilization takes place during a marriage. It is not allowed if fertilization were to happen after a divorce or after the death of the husband. The Sunni Muslims, who make up about 85 to 90% of Muslims, have specific opinions on this issue as well. They believe that no third party should be involved with reproduction or interfere with marital sex and procreation. In other words, a third party donor is not allowed, whether it be the donor of the sperm, egg, embryo, or uterus. The use of a third party donor is considered adultery. Furthermore, surrogacy is forbidden. And Muslim women cannot be a donor or a surrogate, and Muslim men cannot be sperm donors. These are the recent views in regard to religion and assisted reproduction, but it will be interesting to see how the debate between assisted reproduction and religion changes as the procedure becomes more accessible and widely accepted. However, religion does play a large factor in regard to how the public receives the issue.
All right, that brings us to ethical principles. So basically where the ethical principles are involved is mostly with IVF. IVF creates multiple embryos. When there is multiple embryos, you may not necessarily utilize all of them. For each cycle that a couple goes through, they might end up with anywhere from like 1 to 5 or more embryos that they could use. Then the couple has to decide how many embryos they're going to transfer back into the woman to see if they will take. Usually it's advised to just do like 1 or 2 embryos.
obviously we've all heard of like the people that have 6, 7, 8 babies. Those are people who have gone against medical advice and actually put back in probably 5 to 6 embryos. They've put in more than was advised, and they all happen to take. So what happens then if a couple ends up with 4 embryos and they decide during a cycle to use 2 of them? Maybe then they get pregnant and they have the other 2 that are left over. What they can do is then they can save those, and then down the road, if they decide to go through another cycle again, if they want to get pregnant again and they need to utilize assisted reproductive technologies again, they can utilize those embryos. But in the event that they decide they're done with their family, then they need to decide what to do with those embryos. Are they going to donate them, or are they going to just destroy them? If they donate them, that then would be that out there somewhere with another family, there is a child that's biologically theirs that's living with another family. And that's something that's very hard to think about if you are a parent, knowing that somewhere out there there's somebody that is your genetic child that's living with somebody else, but you don't know them. Or the other option, again, to just destroy them. And that is also a very hard thing to think about, because that is an embryo that could give you another child, but you don't necessarily think you want another child. So what ends up happening is in a lot of IVF clinics, there's a lot of unclaimed embryos that just people don't ever decide to make that choice, and they just sit there. So that's a very hard thing to think about. The other things that come from these ART treatments is sometimes there is an increased risk of birth defects. Also, like I mentioned before, increased risk of twin and higher order multiple births. And that can obviously lead to adverse health outcomes for not only the infants but mother, because of the extra strain of the pregnancies. If you even just have a single birth from these technologies, you are at an increased risk of low birth weight. And there is research that shows that babies born from mothers who utilize ART may be at higher risk from birth defects as well. So you just have to think about those things when you are pursuing these kind of treatments to try to conceive. The other kind of last piece we're going to talk about with ethics is gestational surrogacy, thinking about egg and sperm donation. There's a lot of things that you worry about when people are willing to donate eggs and sperm, because there's a lot of things that can go on with like coercion. People are being forced to do things like this, how payment happens for the surrogates or donors, and then just the ability to follow up with donors to assess long-term effects on mental and physical health. Because sometimes people are very willing, like, oh yeah, I definitely donate some eggs, I obviously have extra, let's do this. But then they don't necessarily think long term, like, what does that mean? Oh, that means somewhere out there there's a child that has my genetic makeup that I know nothing about, and just thinking about what that might do to a person. So just is that happening? Are you following up with these patients to make sure that they are okay with their choice and their decision to be a surrogate or to donate their eggs or their sperm?
Okay, and that brings us to potential outcomes. Infertility affects the quality of life for about 10 to 15% of the reproductive age couples, and increases with age of women in ages between 40 to 45. And with assisted reproductive, can alleviate the burden of infertility on individuals and families, but it can also present challenges to public health, as evidenced by high rates of, like you've said, multiple delivery, preterm delivery, and low birth weight delivery experienced with assisted reproduction. And CDC reported that in 2010, there was approximately 147,260 cycles with 47,090 births and 61,564 infants. Infertility affects the quality of life of about 10 to 15% of reproductive age couples, and increases with age of women
increases with age as women ages between 40 to 45. The CDC reported that in 2010 there were approximately 147,260 cycles with 47,090 births and 61,564 infants. The arts can elevate the burden of infertility on individuals and families, and it can also present challenges to public health as evidenced by high rates of multiple delivery, preterm delivery, and low birth weight. The use of reproductive assistance compromises over 1% of all births born in the United States, 18.5% of all multiple birth infants, and 18.5% of twins, and 25.2% of all triplets. This can happen with low birth weight as well, and overprotectiveness of their child. Some parents, this child probably the only child they have, or the only child they're going to be having, so they could be overprotective over the child. Cost and access: about 422 infertility clinics in the United States. Currently, 15 states have laws that require insurers to cover some form of infertility diagnosis and treatment. Poor women and those without insurance are less likely to seek infertility and assistance. Infertility treatment and luxury or medical assistance. Surrogacy is more expensive in the United States compared to other countries. $50,000 in the U.S. compared to $10,000 to $12,000 in India.
Now, with Healthy People 2020 and the ultimate nursing implications, a goal for Healthy People 2020 is to reduce infertility to 11.4%. And from that, a global goal is to improve family building outcomes for all those with infertility and fertility challenges. And as that relates to us in our nursing careers, this is a growing field that may gain public popularity before religious popularity. As Shelby had stated before, in all the religious concerns and judgments based upon the use of ART, we just need to be conscious of our own thoughts and judgments. We need to table our ideas and our own judgments on these women and these families, and just look and understand that infertility is a tremendous burden on families. No one should be scrutinized for wanting a family. So as far as nursing implications go, the general theme is just table your ideas. As the growing field expands its knowledge, expands practice, we'll get the education on how to perform the interventions that we need to. But if we have this overclouding judgment, that will affect our patient care. Now that concludes our project on assisted reproduction. These are our references. Thank you for watching.